Okay, so the last thing we're going to talk about is SIDS, and then we're going to talk about apparent life-threatening events at the end of this. So the etiology for SIDS is unknown. SIDS is sudden infant death syndrome. It's diagnosed as the death of an infant younger than 1 year that remains unexplained after a full investigation and postmortem. SIDS research has been historically confounded by suffocation deaths and by infanticides. There are some theories that it may be a neurologic abnormality that affects cardiorespiratory regulation. There may be a genetic link, or that the child may be rebreathing carbon dioxide, but we really still don't know what causes it. We do know some risk factors and some protective factors. So some things that make it more likely or associated with a higher risk of SIDS are maternal smoking in pregnancy and postnatal exposure to smoke, sleeping prone, bed sharing. One thing that's not really correlated is apneic episodes or apparent life-threatening events, and we'll talk about that in just a minute. Some things that decrease the risk of SIDS are breastfeeding, sleeping supine, a pacifier, a firm sleeping surface with nothing else in bed, a cooler ambient temperature, and sleeping in the parent's room. So we recommend against bed sharing. Some families end up bed sharing anyway, and so we want to talk about the things that make that more risky. If an infant so these are some co-sleeping or bed sharing factors associated with a higher risk of SIDS. The infant is less than 11 weeks, the mother smokes, there are multiple family members in the bed, sleeping with people other than the parents, sleeping on a surface other than a bed, maternal obesity, soft bedding, intoxication, or sedation of anyone in the bed. So all of those things actually make that bed sharing more risky. So what happens when a child presents to the ER that appears to have died of SIDS? Well, first, the ER cannot diagnose that. The ER is going to diagnose that as an unexplained death, and that's going to be referred to the ME for investigation. So what is our role? Well, we support the family. We want to be really careful about blaming or assigning guilt. So we want to avoid all of that. It's not our job to investigate. It's not our job to decide whose fault it is. It's our job to support that family and promote grieving. We also may be asked to support that investigation in some ways. So we need to make sure our documentation is really accurate. And we may be involved in follow-up care. Those families need to be referred for grief support. We also are involved in teaching for prevention. So what are the things we teach to prevent SIDS? Back to sleep, when they need to sleep supine, promote breastfeeding, promote smoking cessation, discourage bed sharing, avoid overheating, and teach about appropriate bedding. Okay. Now, ALTE is an apparent life-threatening event. They don't know what causes it. This is when an infant is found unresponsive but is successfully resuscitated. There are some theories that it's prolonged sleep apnea, that they have excessive periodic breathing, or they have impaired arousal. We used to think this was connected to SIDS, but there's not a clear correlation. Sometimes these patients are given an apnea monitor, which can at least help the families get a little more sleep. The apnea monitor has no effect on the rate of SIDS, does not prevent SIDS. Occasionally, stimulant medications are used. Okay. Now, the very last thing I want you to do, I want you to go back and look at your notes from last year and review the principles of oxygen therapy, because we're bringing all that forward. What do we need to do to give oxygen safely? And that's all for respiratory.